Well, welcome back. More from our Medical Terminology 1 class. Today what we're going to do is we're going to be concentrating more on suffixes. In our previous video, we talked about a lot of rules, some of the rules we have for putting the words together with the word roots and suffixes and prefixes and stuff like that. Talked about some specific rules and where we have to add a combining vowel and things like that. But today what we want to do is we just want to sort of spend our time talking about suffixes and what do suffixes really entail. We're going to give you a list of a lot more suffixes today. Not a complete list. There'll be many other suffixes that can be added. We'll talk a little bit more about suffixes today. So let's go ahead and get this show on the road and talk a little bit more about suffixes. Okay. I'm going to erase that again because what happens is, again, not all medical terms have a word root. Sometimes the word is, the medical term is basically name of somebody or a specific word that really has no word root, suffix, or prefixes, and that's just the way medical terminology is, even though what we want to talk about are the words that do have a word root. Okay. Again, not all medical terms will have a prefix. A prefix is something that would be added at the beginning of the word, and what the prefix does, it just adds more meaning to a word. In other words, it's like I mentioned in our last video, it's sort of like an embellishment. It adds a little bit more pizzazz, to the word. Makes it much more specific. The more things I add to it, the more the word becomes specific. However, if I do have a word root, what happens? They have to end with a suffix. Okay. Sometimes again, the word is just a word root that has a specific meaning and doesn't need it. But we're talking here that generally, if we talk about the general principle of a word root, it's going to have to be finished off with a suffix, which was that first rule that we talked about last time. Okay. And so this is a rule that we mentioned in our previous video. When adding a suffix to a word root, a combining vowel may or may not be used or needed. Okay. That depends upon what the suffix begins with. If the suffix begins with a vowel, I generally don't need to use it. Okay. If the suffix begins with a consonant, I generally will need to use a combining vowel. And we know from our previous video that the combining vowel is usually an O and sometimes an I, but again, O is probably what we use as the combining vowel in most cases. So that's just a review of what we had in our previous video. Okay. So when the suffix begins with a consonant, use a combining vowel, to the word root to combine the word root to the suffix. An example of this, we talked about this word before, Arthur. Arthur means a joint. So I know we have a word that has something to do with something about a joint. Okay, and if I add this suffix, like we had last time, which is called dynia, and dynia means pain, okay, Arthur dynia, it just doesn't sound right, okay? Why? Because dynia as a suffix begins with a consonant, so therefore what do I need to do? I move the dynia apart, I'm going to add my combining vowel right in there, and I'm going to move my dynia back in, so now arthrodynia, it makes it much nicer word. So if the suffix begins with a consonant, I'm going to add that combining vowel in between. It just makes the pronunciation and everything of that word a little bit better. Okay. Uh, when the suffix begins with a vowel, do not use a combining vowel. Okay, because again, it's already there. So let's go back and let's get rid of the dynia. Okay, and let's add a suffix that begins with a vowel. Okay, algia. Now, algia also means pain. Okay, arthrodynia is the same thing. Would mean the same. It means pain. And arthro and this algia also means pain. However, let's think about this. Arthralgia. It just doesn't sound right. Why? Because the algia as a suffix begins with a vowel. So let's go ahead and get rid of that combining vowel. So let's get rid of it. Let's make it vanish. Poof, it's gone. And now what happens? Let's move the algia, arthralgia. Arthralgia is a much better sounding word. It works well because I have my word root here. My suffix begins with a vowel, and therefore I don't need a combining vowel to link the two together. It's already there. It's already built in. Okay, so arthralgia would be the proper way we'd say this. And again, arthrodynia and arthralgia both mean the same thing. I've as a medical term, I've used arthralgia multiple times. I don't think I've ever used the word arthrodynia. Okay, but that's just that. The meaning of a suffix doesn't change. In other words, suffixes, once I learn what a suffix means, it's going to stay consistent through all of eternity. Okay, so typical example, if I see the word oma after something, it all means some type of a tumor, or I'd probably say mass as well. Tumor or mass. Okay, so if I see oma at the end of a word, it means a tumor or mass. Okay, I can't always say tumor, but I'm adding mass because when somebody has a hematoma, it's really not a tumor, but it's a mass of blood that creates this little clot, okay? But what happens is because that suffix does have a specific meaning, the suffix will alter the meaning of the description of the word root. Again, the word root gives me a general domain in which that term is going to be, but what happens is the suffix, which I need to finish it off, gives that word a much more specific definition, okay? It will also change the word root as a part of a speech. Again, a noun is the name of a person, place, or thing. We talked about that, but also we talked about adjectives in our previous video on rules. These are those AL, IC, IAC, and stuff like that that make the word that's being made into an adjective. An adjective, we know, is something that describes a noun. So if I have an adjective, it should be followed by a noun, okay? So that's just what we talked about in our previous discussion. So suffixes will change the word as a part of speech, just like I say. And let's just look at that noun versus adjective. Duodene, okay? Duodene stands for the first portion of the small intestine. Once the material that's in the stomach leaves the stomach, goes into the first portion of the small intestine, which is actually small. It's only about 9 to maybe 12 inches long, which is called the duodenum, okay? So duodene would be the word root, okay? So let's add a suffix, okay? The noun suffix would um. Is just a specific noun suffix. So duodenum would be the name of that particular structure. So therefore, it's a noun. Okay, so duodenum would be that. However, if I take that take that off there, and add something else like an al, duodenal, L is an adjective suffix. So duodenal what? I ask myself. Duodenal ulcer, duodenal tumor, duodenal something, where duodenal would be the adjective and then the ulcer or the tumor would be the noun. So it's basically something that describes a noun. And so just by changing the a couple words, a couple letters at the end of a word makes a difference. Duodenum, the name of that portion, that structure. Duodenal, something that describes something that's going on, like a duodenal ulcer, duodenal tumor, duodenal rupture, whatever the case may be, okay? Suffixes, again, making form word roots into surgical or other procedures, types of surgery, specialties, specialists, and conditions. Again, we have a whole long list of different types of suffixes that we could consider. Okay, and we'll talk about this. Let's look at just this word and show you how we could change what that suffix actually means in regards to procedures, surgeries, specialists, conditions. Nephro. Nephro we talked about before means kidney. So that's a word root that we know that if we see this word root, we know it has something to do with a kidney. So let's start adding some suffixes and see if we could actually change that meaning of that word. Okay, ectomy. Ectomy is a word root, as a suffix that means the removal of something. So if somebody has a nephrectomy, it means the removal of a kidney. So ectomy would be a surgical procedure. Okay, it's a type of a surgical procedure, nephrectomy, removal of the kidney. Okay, so but I could take that suffix, get that suffix out of there, get it out of there. Ology. Ology means the study of something. Okay, the study of something. So it's basically a specialty. Nephrology, the study of the kidney. So I've gone from procedure to a study of something, which is basically a specialty. Okay, I could change that, get rid of it. Ologist would be a specialist, one who studies the kidney. Okay, nephrologist would be one. So we've gone from a procedure to a specialty to a specialist, and I can even further change it. And let's go to itis. Itis is a suffix that means inflammation, very common suffix I should mention, and it's basically a condition. Okay, so basically, I've changed nephro multiple different ways, from procedures or surgeries to specialists to specialties to conditions. I mean, it's pretty simple to be able to do something like that. But just by some simple suffix manipulations, I'm able to change the word pretty much totally, even though it all has something to do with the kidney. When defining a medical term, again, begin the definition by defining the suffix first, and then jump to the beginning and go back, and then read from left to right, okay, as we talked about in our rules before. So if I take that was coming from all different directions. Pericardiocentesis, my gosh, that sounds like a $5 word. And basically, let's look at this. And what we do is let's take the suffix. The suffix is centesis. Centesis means to take a needle and do a surgical puncture with a needle to draw something out. What they're doing, so they're doing that surgical needle puncture around, because peri was a prefix that we had before. Cardio means the heart. We talked in our previous rules video that the heart is surrounded by a sac called the pericardium. So if the pericardium fills up with fluid or pus or something like that, they take a needle, stick it through the chest right into the pericardium, and that's that centesis, that needle around the heart. And so I'd start out with 1, 2, 3, and define the word in that direction. Okay, so that's what we talked about at the very end of our initial video in regards to rules. Okay, piece of cake. So we describe the suffix first, then we go to the beginning of the word, the peri, the prefix, and then we go into the word root. And if there's another word root in there, we go from suffix to prefix to word root 1, word root 2, and then finally into the, that defines the whole word. Now let's talk about some noun suffixes, and these are pretty boring for the most of these. Okay, a, ate, ema, isis, ia, iatry, ion, ism. Some examples, like a, scleroderma. Sclero means hard, derm means skin, and A makes it into a noun. Scleroderma is a condition where what happens, it's a connective tissue disorder, which is actually pretty bad, okay? Then what happens is the tissues become hard, okay? Eventually the esophagus and other tissues become hard, not just the skin, but other tissues, and people will frequently succumb to that over a period of time. It's a much longer, slower demise because of that, but that would be called scleroderma, and that's the name of a particular disease, okay? 8, something that hemosylate is something that will lyse, which we talked about as a suffix before, will break things down. Breaking things down, what? Hemoblood. So things that break down blood would be called a hemosylate. Okay. Here's a noun ending, dermatome and E. Okay. What you find is what happens is the nerves are represented in the skin in various strips. Okay. What happens is, we have the brain and we have the spinal cord that comes down the back, and at each segment we have nerves that will come out of the spinal cord. Those nerves have sensory nerve endings that will end up somewhere. Okay. All of our body is supplied with these sensory nerve endings. So what you actually find is we find strips of skin that are actually supplied, by a particular sensory nerve, and those are called dermatomes. And again, it just made it, derma means skin, and tome actually means cut, to cut, and basically the E just makes it a noun ending. Emia, we had this one before. Emia is basically a blood condition. So if you see emia at the end of a word, hypoglycemia, again, this is one we had in the rules. Emia, blood condition, low sugar, blood, low sugar, piece of cake. ER, one who, radiographer is one who takes x-rays or radiographs, okay? Esis, a condition. Diuresis is a condition of getting rid of urine, okay? So esis means a condition of something, okay? IA is also a condition, paraplegia. So in other words, para, would be either upper or lower extremity, and then plege means paralysis, IA means a condition of. So basically IA means a condition of something, IATRY, medical treatment or profession, psychiatry, piece of cake. ION, process, induction, the process of inducing. When they put people to sleep under anesthesia, it's called induction. So it's the process of inducing the anesthesia. Okay, so that's what that is. An ISM is a condition. Hirsutism is actually a condition of facial hair in females. Okay, usually because of high levels of estrogen, which the estrogen actually, this is sort of interesting. Estrogen and testosterone are almost like twins. Okay, they're really chemically close, and estrogen can be converted to testosterone, and testosterone can be converted to estrogen. So females who have very high estrogen levels, like in ovarian cysts and stuff like that, frequently start to develop some facial hair, and they do that because a lot of the excess estrogen they have is converted to testosterone, and the testosterone forms a masculinization or development of facial hair in females. So basically that's what, but ISM means condition, hirsute means hair. Okay. Here's some other ones. Another noun suffix is IST. Again, basically that's a practitioner, cardiologist. So you see IST at the end. Nephrologist studies the kidney. Cardiologist studies the heart. A nephrologist or a pulmonologist studies the lungs. A neurologist studies the nerves in the brain. Okay, OLE means small or little. Arterial. So we'll talk about these in the cardiovascular section. Arterial, OLE, means small or little. These are small or little arteries, and they're different from the major arteries. Most of the arteries that we have, when you feel a pulse, you're feeling an artery, and the walls of the arteries have a lot of elastic tissue, which then, when the blood goes through it as the heart beats, causes a bulging or a stretching of that wall, and that's what you feel as a pulse. However, when I get down to the smaller structures, they're taking blood away from the heart. What happens is these are lined not so much with elastic tissue, but muscle tissue. And then muscle tissue can either constrict and get smaller or relax and get bigger. In fact, people with high blood pressure, what happens is these arterioles, the muscles in the arterioles become very hyperactive. They squeeze down a lot, and therefore what happens is I have the same amount of blood going through a smaller tube. It increases the pressure, therefore my blood pressure increases. And what they do is a lot of times when they treat high blood pressure, what they do is they treat it by giving someone a medication that relaxes the muscles in the arterioles. So now instead of being small, they dilate, they get larger, and therefore it decreases the blood pressure. But OLE means small or little. OSIS, we talked about before, means condition. Cyanosis. Cyan, C-Y-A-N, means blue. So when people have that blue tinge around their lips, around their fingernails and stuff like that, when their oxygen levels in the blood go down, that's called cyanosis. So osis just means a condition of something. TION, the process of fixation. Which means the process of fixing something. A lot of times what happens if somebody has a fracture, if they have surgery, or whatever the case may be, what they'll do is they fix the two pieces of bone together by putting screws, plates, wires, staples, all kinds of other things to hold the bone together, and it's called fixation. Okay, so basically TION means the process of something. Okay, ULA also means small or little. Macula. Now you've probably heard the word macula somewhere, and you've heard macular degeneration. AR is what? An adjective suffix. Degeneration would be the noun. What type of degeneration? Macular. Okay. If I was to take a pin, which I'm not going to do, definitely, I'm not going to do this. I mean, I love y'all, but I'm not going to do this. If I took a pin, stuck it straight through the pupil of my eye, and stuck it back all the way to the back, it would hit a very small spot, right straight back. Behind my pupil, and that area is called the macula. And the macula is the area of the most number of neural fibers back there with the best vision at all. It's my central vision. If you notice when you look at something, you look at it directly. And everything that you see directly is nice and in focus and really well defined. Everything to the periphery is a little bit less defined, a little bit hazier. And the reason why is the best vision is straight back, and that area is called the macula. Macula means it's a small spot. You know when the doctor looks inside your eye, you're sitting and then they take that little thing and they look inside your eye, or sometimes if you're at the eye doctor, they have that little lens and they shine that bright light in there they're looking right back in your eye, and they can see all the vessels on the back side of the retina of your eye, but they can also see the macula. And what happens is people get older, and don't look at me that way, when the people get older, what happens is that macula starts to degenerate. And as a result, what happens is because the macula right in the center, that small little area, it actually looks like a little dot. When you look at in the back of the eye, it looks like a little dot, and it's sort of blushed around the outside of that. But that little, you could actually see that little spot, very small little spot, and that's the best vision. Well, as people get older, that area starts to degenerate, and it's called macular degeneration. And that's why older people, when they have macular degeneration, sometimes they have to look at you sideways. They have to look at you sideways because they can't see directly ahead. They actually lose that central vision, and they start to see in the periphery. Okay. So anyway, but getting back to what we're talking about, ULA means small or little. Also, ULE also means small one. Okay, a venule, where the arteriole was a small artery that's more muscular, a venule is a small vein. Okay, what happens is arteries become arterioles. Arterioles then lead into capillaries, which are what we call exchange vessels, and they have holes, they have really thin walls, and things could leak in and out of the capillaries. Then from the capillaries, they have to go back to the heart, and they go back to the heart by venules, and the venules become veins as they get bigger. Again, means a singular noun. We talked about that being duodenum, that first portion of the small intestine, just a couple minutes. US is Also a singular noun, coccus. When we talk about strep, strep is actually streptococcus, streptococcus, and coccus means a small ball. When you look at streptococcus underneath the microscope, it looks like a bunch of grapes. You see the small little purple, blue, dark purple to blue balls, and basically a coccus is a small round ball, okay, and that's the streptococcus. Cocci, C-O-C-C-I, would be a plural form of that, but coccus means it's a singular noun, and Y is just a noun ending. They don't know what else to add to it, okay. And myopathy, myo means muscle, path means disease, and I have to make it into a noun, so add the Y onto it. So that's what these are some noun suffixes that we have. We talked before about adjective suffixes, and that's that same word, that same list we had before. AC, pertain, and guess what? These are mostly all pertaining to. Most of them are. Some of them, a couple of them aren't. But pertaining to, like cardiac means pertaining to the heart. Cardiac catheterization, like I talked about, catheterization would be the noun, and cardiac would be the type, which is basically makes it into an adjective. AL, pertaining to renal, renal dialysis. Dialysis would be the noun because that's the name of something. What type of dialysis is it? Renal dialysis, and the AL makes it an adjective. AR, pertaining to ventricular. Sometimes after a heart attack, the wall of the muscle, when people have a heart attack, the muscle never comes back. What happens is the muscle actually dies. It's replaced by a dense, more like scar. And sometimes what happens, that scar creates a little bulging, which is called an aneurysm. So a ventricular aneurysm would be a bulging, of the bottom part of the heart, and basically aneurysm would be the noun, ventricular would be the type that makes it an adjective, and has that AR as an adjective suffix. ARY, pertaining to pulmonary. If somebody has a pulmonary neoplasm, neoplasm would be a tumor. What type of tumor is it? Tumor would be the noun. What type of tumor is it? Pulmonary. Because the pulmonary describes a noun, it becomes an adjective, and ARY makes it an adjective, okay? EAL, pertaining to esophageal, esophageal irritation. Irritation would be the noun. What type of irritation is it? It's esophageal. EAL makes it an adjective. IC, pertaining to gastric surgery. Surgery would be the noun. What type of surgery is it? Gastric surgery. IC makes an adjective. ICAL, pertaining to hematological studies. The study would be the noun, or studies would be a noun. What type of studies is it? Hematological. ICAL makes an adjective. ILE, pertaining to or capable of febrile seizure. Kids sometimes have what are called febrile seizures. That's really not uncommon. When the temperature, think about younger kids, is they have a tendency to have a much higher temperature elevation in fevers than adults. As a result, sometimes it gets quite high. I know that my older son had febrile seizures when he was a year old. I almost remember it. He was a little bit less than a year old. He had what was called roseola, which is very high, very typical, where the fever goes very high. Okay, and when he had this, he started getting this seizure activity, and they're called febrile seizures. In this situation, and that doesn't mean that they have epilepsy down the road or anything like that. It just happens. Okay. Not uncommon in kids. Not that it doesn't freak parents out, to all ends. It does, but what happens is that the noun here would be seizure, and what type of seizure is it? It's a febrile seizure. So ILE makes it an adjective. OID, this is one that's different, means resembling. Erythroid. Sometimes people get a red colored rash. Erythro means red, okay? So erythroid rash would be a red colored rash, okay? What's the noun? Rash would be what it is, but what type of rash is it? It's erythroid. It's red colored. Okay, so OID means resembling red. Okay, or resembling. OID means resembling. Erythro means red. Okay, ORY, pertaining to auditory test. When you do a hearing test, they do an auditory test. Basically, the test would be the noun. What type of test was it? Auditory. ORY made it an adjective. OUS, pertaining to venous, pertaining to a vein. Okay, so OUS means pertaining to a vein. Sometimes when people have dialysis, because what happens is they have to, with hemodialysis, they have to insert a needle to be able to remove and to replace the blood as it goes through the dialyzer that takes all the impurities out. So what they sometimes is they get what is called an arteriovenous shunt. So OUS means, and a shunt would be the tube that they could actually stick the needle in so the vein doesn't get all scarred and contracted down. So they make this venous shunt, which an OUS makes it an adjective. Okay, TIC pertaining to cyanotic, pertaining to cyanotic coloration. Okay, coloration. Coloration would be the noun. What type of coloration is cyanotic? A cyano, like we talked about, means blue. Specialties and specialists, boring. This is really, I'm going to spend almost no time. ICAIN, obstetrician, means, IATR, pediatrics, is a IATRY, a profession, psychiatry. IATRI is one who treats, or a physician, psychiatrist. Okay, these are IAN, a specialist, pediatrician. IST, a practitioner, physical therapist. Logist, one who specializes in the study of. Embryologist, one of embryologic development. Logi, the study of embryology. Okay, basically these are specialties and specialists. Not really very exciting. Okay. Now we get to some good stuff. Okay, and this is stuff that's a lot more exciting and a lot more, keep you on the edge of your seat. Centesis, we've already talked about that, is basically that's a surgical puncture. Amniocentesis, sometimes in females when they're pregnant, if they're concerned about the genetic related problems to the fetus, what they do is they do an amniocentesis. They take a needle, stick it through the abdominal wall into a sac that surrounds the baby called the amniotic sac, and basically they remove the fluid, and the amniotic fluid that's in this sac has fetal cells in there. It's sort of like a snow globe. Stick the baby inside this sac, the baby's losing cells. These cells are floating around in this fluid, so when they stick the needle in and suck it out, they invariably get some of the cells. They could take those cells and look at that. They could look at the chromosomes, look for abnormalities. So, but centesis means a surgical puncture. Chlasis means to crushing something up. Osteoclasis. Sometimes if they have a big chunk of bone, they could just go and just crush it up to remove little pieces, and that would be called osteoclasis. Because clasis means a surgical crushing or breaking things up. Desis means a surgical binding or surgical fusion. Arthrodesis, well, we know arthro means joint. So what happens is sometimes if somebody has an arthritis, what they do is they actually go in and remove the joint. They surgically go in with a saw, take the joint out, put the raw two pieces of bone together, and then bind it together with screws, plates, wires, staples, and stuff like that. And then what happens is there's no joint there. It's just one solid bone going across from one bone to the other, and that would be called an arthrodesis. They joint, they fuse. They surgically fuse or surgically bind a joint. Ectomy, we talked about that before. That means a surgical removal. Appendectomy, removal of the appendix, obviously. Gram, boring. Record or picture, electrocardiogram, electrical imaging of the heart. Okay, we'll talk more about the electrocardiogram when we do the cardiac section. I have some good pictures in regards to electrocardiogram, and basically the heart runs on electricity, and the electricity actually sends a current that actually can be detected through the chest wall, and they're detecting the electrical current that's going on in the heart, which has a certain pattern, and it depends upon which area that they look at it, it will look a little bit different, and that's what they do with called electrocardiogram. How they do get that? They get it with an electrocardiograph, which would be the recording instrument, and the process of doing that would be called electrocardiography. Okay, eyes means to treat or to mate or combine. Anesthetize. This is an interesting word, okay? Because eyes means to make, to treat, or to combine. So look at the ending here, we see the eyes. And means without. That's a prefix that we had earlier that means without. And aesthesia means sensation or perception. So basically, to anesthetize means to make without sensation. And that's anesthetize, okay? Lysis, we had this one before, means the destruction. Okay, osteolysis. Osteo means bone. Lysis means destruction. Some types of tumors will cause an osteolysis. When you look at them under x-ray, what happens? The bone has been destroyed or removed, and it's called an osteolysis. So lysis is just a suffix that means the destruction of something. And meter is basically what we talked about before, an instrument to measure. Pelvimeter. When baby's coming down the birth canal, they have to make sure that the head is not too big for the outlet in the female pelvis. So what they do is they sometimes could use an instrument that will measure the size of the pelvic outlet just to make sure that the baby's head's going to be able to make it out. If the baby's head can't make it out, the mom could push all they want with their and uterine contractions, but guess what? Ain't going to happen. That's when they do a C-section. Okay, so hopefully all these little medical things are helping you understand the words a little bit better. We got more though. Oh my gosh, more. Metry. Okay, metry Basically, again, the process of measuring is called metry. So the pelvimetry would that be that? They use a pelvimeter for pelvimetry. Piece of cake. Opsy is nice because it's the process of viewing something, process of viewing, okay? And biopsy. When they do a biopsy, what they do is they take out a piece of tissue to view that tissue underneath the microscope to see if the cells look normal. Bio is a word root that means life or living. Okay, so what they do is they take out the living tissue and they look at it, opsy, process of viewing it under a microscope to be able to look for abnormal tissues. That's where they get the word, where they get the word biopsy. Pexy. Pexy means a surgical fixation. Nephropexy. Again, sometimes if the kidney is moving up or down, it puts stress on this artery called the renal artery, and that really is a really significant thing that will involve blood pressure. It causes the blood pressure to go up. So what happens is sometimes they have to go in and fix. Actually, people don't understand, but the kidneys aren't two little things that are floating in the back freely in the abdominal cavity. They're actually stuck to the back side of the abdominal wall. Okay, and so what happens? Sometimes you have to fix that to make sure it doesn't move. Also, when male child as a fetus, the testes develop inside the abdomen. Just like the ovaries do. And in a period of time, what happens, these testes will actually migrate down through a canal in the lower portion of the abdomen. We'll talk about that later on. And what they do is they migrate down, they end up in the scrotum in the male child. Sometimes they don't. And that's that, quote, undescended testicle, or it's called crypt orchidism. Orchid, don't ask me why, is the word root that means testicle. Okay? So sometimes as a kid gets older, they actually go up surgically up that canal in the abdominal wall and bring the testicle down and sew it to the inside of the scrotum. That would be called an orchiopexy, because orchid or orchio means testes. Pexy means a surgical fixation. And they do that to maintain a temperature regulatory type of a situation, so that what happens is spermatozoa later on can be produced normally. Plasty means a surgical repair of something. Again, rhinoplasty, rhino means nose job. Raphy means a suturing, and herniorrhaphy. What happens to hernia is basically a weakness in the abdominal wall. And because of this weakness, okay, and the abdominal wall has multiple layers of muscles, as well as this dense tissue called fascia that holds things together, as well as an inside lining of the abdomen, which is called the peritoneum. And what happens is, if that area is weak, when people cough, strain, stand, or whatever the case may be, the pressure in the abdominal cavity increases and forces the intestines to actually come out through that little weakness in the area of the wall of the abdomen, and therefore sometimes that causes pain, stretching, and stuff like that. That's why people get that bulge. So what they do is they go in surgically, they go in and then sew it closed. Okay, 2 summers ago, I ended up having what's called a right inguinal hernia. I had a left inguinal hernia when I was like 17, and about 2 years ago I had a right inguinal hernia. I don't know how I got it or where it came from, but it was sore. And basically I had a right inguinal herniorrhaphy, where they went in, closed the hole, covered it with a patch of a graft to go over the top of that hole. So now the intestinal contents don't come out in the lower area of the groin. Okay, so raphy means suturing, and suturing means sewing, if you didn't know what suturing means. Scope. Scope is an instrument to view. Okay, sometimes what they do is they could look inside a joint with a scope, and it's called an arthroscope, because we know arthro means what? Joint. Hopefully by this point you're saying, you know what, I'm very passively learning a lot of these new terms, which is actually very exciting to me. Okay, so they look inside. In fact, a lot of surgery now that they do is called arthroscopic surgery, which brings you back to a good point. In arthroscopic surgery, what's the noun? Surgery would be the noun. What's the adjective? What type of surgery is it? Arthroscopic. And I've made arthroscope into scopic because IC is an adjective suffix that describes the noun, the surgery. Piece of cake. And so that's an arthroscope. Scopy would be the process of viewing. So arthroscopy is done with an arthroscope. Okay. Stomy. Stomy means the surgical creation of a new opening. Colostomy. Sometimes what happens after colon surgery, whether it be a cancer or a ulcerative colitis or something like that, what they actually do is they actually make a small hole in the abdominal wall and bring the intestine up to that small hole and sew the wall of the intestine to the skin on the outside. And they could put a bag over that area that's attached by an adhesive. And what happens is all the fecal material, simply because they're diverting the flow. So it's no more any anal deposition of fecal material, but comes out through this little hole, and that'd be called a colostomy. Okay, so colon means colon. Okay, ostomy means creating a new surgical opening. Okay, tomy means an incision into something. Incision. Gastrotomy. Gastro means stomach, so gastrotomy would be an incision into the stomach. Okay. Arthrotomy would be incision into a bone. Tripsy. Tripsy means crushing. It's intentional crushing. This is a word that you may have had some familiarity with. Lithotripsy. Litho means stone. So sometimes when people have a kidney stone, what they do is they do what's called a lithotripsy. And a lot of times they use ultrasound. They blast the stone with ultrasound. And the ultrasound, because it's so a high intensity sound wave, actually will take the stone and crush it into small pieces. So now they could pass it out to the outside. So it's not this big lumpy hard rock of something, but small little gravelly pieces that can be eliminated. And that would be that intentional crushing would be called a tripsy, lithotripsy, crushing a stone. I have a few more common suffixes here that we haven't already talked about. AD. AD means toward or increase. Cephalad means head. So something that's closer or towards the head would be called cephalad. So AD means towards or an increase. Algesia means a sensitivity to pain. Means a sensitivity to pain. Algesia. So and, this is where we have a prefix and a suffix that are together. And what was a prefix that meant without? So analgesia means without sensitivity to pain. So like aspirin, Tylenol, Motrin, all these are analgesics or analgesic medications. Medications would be the noun. IC adjective suffix, but analgesia would be it would be without sensitivity to pain, because algesia means sensitivity to pain and means without. Algia, we talked about that before, means pain. Myalgia, means muscle pain, piece of cake. Blast. If you see the word blast at the end of anything, it's an embryonic stage of development, which means it's a very early cell. It's not a fully grown adult cell. It's a juvenile cell. Erythroblast would be an immature red blood cell. Okay, red blood cells, we'll talk more about those later on. And red blood cells are basically very unusual cells, because they don't. It's the cell in the body that does not have a nucleus. They actually throw the nucleus out. Erythroblast does have a nucleus, but as the red cell matures and goes through this maturation process, it destroys the nucleus and gets rid of the nucleus to the outside of the cell, and it's basically packed with hemoglobin. Why? Because the hemoglobin carries oxygen. So the erythroblast would be an immature or premature or embryonic or an early red cell before it's adult. Okay, and these are in the bone marrow. They don't really get into the outside too much. Okay, out into the bloodstream. Seal means a swelling or herniation. Cystocele. Females, when they have multiple children, okay, have multiple pregnancies and multiple childbirths, what happens is sometimes the wall between the bladder and the vagina become very thin. Okay, and becomes not very supportive, very weak, and as a result, now the bladder sometimes pushes into the area of the wall of the vagina, which then causes pain, and that's called a cystocele. Sometimes it's also on the backside, which is also causing a rectocele, where the rectum posterior to the vagina may cause a problem like that. So anyway, cele means a herniation or a swelling. Okay, sometimes guys, they get a sac around the area of the testicle, which is called a hydrocele. Hydro means water, and this swelling around the testicle is basically a sac of water. It's called a hydrocele. Okay. So cele means swelling or herniation. Side means to kill or destroy. Spermicide means something that would kill spermatozoa. Bactericide would be what? Kills bacteria. Piece of case. Homicide, kill people. Same. Okay. So basically one of your like, okay, that would be homicide. So anyway, infanticide, killing a child. So side means to kill. So those are easy. That's an easy one to remember. Cyte means cell. Erythrocyte is the adult form of the erythroblast. Cyte means cell. Okay, so this is basically a red blood cell. Erythro means red cell. Cell, red cell. Okay, so that's what the dynia we had before means pain. Okay, cephalodynia. I've never heard this word. I sort of made this one up just to sort of give an example. Cephalo meant what? Head. So cephalodynia would mean headache. Sure, what the heck? Although I've never used that word. Okay, I'd say headache. That works. It works just as well for me. Okay. Ectasia means a stretching or dilation. Gastrictasia. As we eat, the stomach is an interesting organ because the stomach can stretch a long way. The bladder can stretch a large way. The cells in it and the way that the layers of the tissue in there allow the stomach and the bladder to stretch a lot. And so when the stomach stretches, we call it gastrictasia. Okay. Gen means something that generates or produces. Okay. Glycogen. Okay. Glycogen. Glyco means what? Sugar. Gen means formation. What happens is the body can't store sugar, okay, as sugar itself. It can't store it as glucose. So what the body does is it takes the glucose that it wants to keep, okay, and puts it into something in a longer storage form. And that longer storage form is called glycogen. So what happens is that now this glycogen, which is a long chain of glucoses that are put together, okay, it gets stored in the muscle and gets stored in the liver. And when my blood sugar goes down, I can actually take the glycogen out of my muscle and my liver and cut it up like slicing up a loaf of bread and make sugar that can be used for producing energy in the body. Okay, so gen means something that generates. Couple more suffixes. Genesis we've had before, means generating or forming. Lithogenesis. Litho means stone, so things that are lithogenic or lithogenesis would be the process of forming stones. So people might have a greater tendency to form stones. Most kidney stones are what are called calcium oxalate. And people say, well, don't drink so much milk with the calcium. Actually, it's not really the milk, it's the oxalate. Oxalate is something that we get in colas, teas, some leafy vegetables and stuff like that. When my body has a lot of oxalate, it grabs the calcium and creates a stone. Okay, so it's not really the calcium that's causing the problem, it's the oxalate. But anyway, that's it. Litho is stone, but genesis means the creating or formation of stone, okay, or formation of something. In this case would be the stone. Genic, pertaining to the formation, so something is lithogenic would be pertaining to the formation of a stone. Gravida means pregnancy. Okay. Multi, that should not multi, but should be M-U-L-T-I. Multi means many or multiple. Okay. A female who's multigravida has had multiple pregnancies. Okay. Primigravida, primi means first. Okay, so if someone is primigravida, it would be the first baby, first pregnancy. If they're nulligravida, null means none or never before. So if somebody's never been pregnant, they're called nulligravida. Okay, so gravida means pregnancy. IASIS, we talked about this before, the presence or abnormal formation. This is an interesting word. Here's IASIS, which means the presence or abnormal condition. Coli, lith. Now I see lith. I know lith means stone. We've talked about that so far multiple times. So we know from something about the formation or condition or the presence of a stone. Coli means gallbladder. So cholelithiasis would be the condition of gallstones. Abnormal condition of gallstones. Okay. Itis, we've had this before. We talked about this before. Inflammation, appendicitis, inflammation of the appendix. Okay, lepsy. Lepsy is a seizure or attack. Okay, narcolepsy. Narco means stupor. Okay, so narcolepsy. You see these little commercials now about, Mama, wake up. You got the lady with her head down on the counter and the kid that's asleep on the bus, and it looks like at a soccer practice or something like that. Have to wake them up again, stuff like that. Oh, are you suffering narcolepsy? Well, narcolepsy, basically, some people are very fatigued all the time. They sleep a lot more than they should. And that's called narcolepsy because narco means stupor. Epilepsy, is basically a seizure, So we'll talk about that later on. Okay, lith, we've had this before, stone. Okay, stone. Phlebolymph. Phlebo is a word that means vein. These are some stones that sometimes people get in the vein where the vein doesn't allow the blood to flow and it becomes hard because it's called a phlebolymph. Okay. Lithiasis is the presence or formation of stones. Nephrolithiasis, the presence or formation of, guess what? Nephro, kidney. Lytic. Lytic is destruction of something. Something's lipolytic, means it destroys fat. Okay. Actually, if you notice your hands are greasy, one way to get the grease off is use something that has an alcohol base. Alcohol is lipolytic. It breaks up fat. and as a result, what happens is that then the hands don't feel as greasy because the alcohol has a tendency to be lipolytic. Lipo means fat. Liposuction, lipoma. We talked about those before. Lipolytic. The alcohol is lipolytic. It breaks up fat. Mania. Ooh, mania is a mental disorder. Ooh, a nice word. Trichotillomania. Trichotillomania. Well, tricho means hair. What trichotillomania is, see, people are always playing with their hair, they're twisting their hair around and stuff like that. That's called trichotillomania. I can't say it's like, hey, we've got to commit this person, they have a trichotillomania. I don't think it's quite that bad. But on the other hand, what happens is sometimes they play with their hair. You know what they sometimes do? They eat it. They get these hairballs, and stuff like that. So as a result, it's probably not the best thing to do. And actually, you see some of these people will have patchy hair loss, and that might be because of an excessive type of trichotillomania, which basically is a little bit more of a problem. Okay, but mania means madness. Megaly. Okay, megaly means enlargement. Cardiomegaly, enlargement of the heart, because cardio is a word that we had before. Ulmo, we talked about that, is tumor. Lipoma, fatty tumor. Myoma, we mentioned was muscle tumor. Nephroma, kidney tumor. Okay. Opia. Opia is basically says a visual condition. Myopia. My means muscle. Opia. What happens is this is sort of an interesting thing. The lens of the eye, if you look at the pupil is black. And it's not that the pupil is black, it's just that it's a hole. And the inside of the eye is very dark. Right behind the pupil, we have a lens. And that lens focuses the light that comes through the pupil, okay, and focuses it on the retina. Well, that lens could actually be made wider or narrower. And around that rim of the lens are muscles. And those muscles will actually control the size of the lens to help in focus. Okay. Well, sometimes what happens is these muscles don't work quite right, and as a result, the focus is not good, and that be myopia. Okay, the myopia means that the muscles that will control the size of the lens aren't working quite right, and therefore the focus on the retina, on the back of the eye, where all those nerves are that pick up vision, just don't seem to be able to be sharp. Okay, and that'd be called myopia. Okay. Amblyopia. When people have a quote that lazy eye, where one eye is visually weaker, basically that's called an amblyopia. What they do is then they patch the good eye to try to strengthen the bad eye. So you've probably known somebody who's a patch on one eye, and they put the patch on the good eye to try to make the bad eye better. Okay, and opsia is also a visual condition. Okay, now this is an interesting word. Hemi. We've had all the parts of it now. Opsia and an. Opsia means a visual condition. Half. Hemi means half. And means without. What happens is the eyes have an optic nerve that comes back, straight back. Okay. The back of the eyeball is on the nerve goes back and goes directly to the brain. It's called the second cranial nerve. What happens is part of that second cranial nerve, the cover of the optic nerve, once it gets beyond the eye, it gets inside the skull. Part of it crosses over to the other side. So half of it, in other words, if I have an eye here and I have an eye here, okay, what will happen is this nerve will come this way, okay, but part of it will actually go and cross to the other side. And then this over on this side, will come this way, and part of it will actually cross the other side. Well, this is the nerve that goes to one side of the brain. This is where it crosses, called the optic chiasm. Sometimes, depending upon where they have like an injury or a tumor to a nerve, they lose half their vision. And when they lose that half their vision, that's called a hemianopsia. Hemi, half, and without opsia, vision, okay, or visual condition. Pathy, disease. We've had that myopathy, a muscle disease. Penia. Penia is a decrease or deficiency. Leukocytopenia. Now we mentioned cyto before. Cyto means cell, okay, and penia means deficiency. Leuko means white. When I have a low number of white blood cells in my blood, it's called leukocytopenia. See how these words come together? I mean, it's beautiful the way that this is all put together. Philia. Attracted to something. Oh, this is something you don't want. Necrophilia. Necro means dead or death. Okay, so if someone has necrophilia, it means they're attracted to dead things. Okay, I mentioned this to somebody in the class a about a year and a half ago, and I said, it's like, like Jeffrey Dahmer. She says, I was actually in the movie, that My Friend Dahmer. I guess she went to the school out there in Bath. But anyway, necrophilia. Philia means you're attracted to something. Okay. Phobia, on the other hand, means it's an abnormal fear of something. Photophobia. Now, photophobia doesn't mean that you don't want to have your picture taken. Photo is a word that means is a word root that means light. So sometimes people become sensitive to light. Okay. If you have migraines, where do you want to be? You want to be in a dark room. Why? Because the light bothers you. And that's called a photophobia. It bothers you. It's not really an abnormal fear. Take me out of the light, or whatever. It means that what happens is bother you. So phobia is an abnormal fear or an abnormal sensation. So phobia. That's what phobia would be. Plasia we've had before. Formation of development, hyperplasia, excessive development. Plesia we've had before. Paralysis, hemiplegia, paralysis of half the body. We've had that one before. Not a big deal. Okay, guess what? And the list goes on. PNEA we talked about before is called breathing. Okay, dyspnea, difficult breathing, we had that before. Ptosis we've had before. Drooping or prolapse, nephrotosis, drooping of the kidney. Ragia we've had before. Excessive flow or discharge. Menorrhagia, when females have an excessive amount of menstrual flow, it's called menorrhagia. Okay, so and so it's not just normal, but it's excessive flow or discharge. Rhea is also a flow or discharge. Rhinorrhea, that runny nose, because we know rhino means nose. Rhexis is rupture, arteriorhexis, rupture of an artery. I've never seen that word, but I suppose it's there somewhere. Stasis, stopping or controlling. Hemostasis. What do you think? If you have a little clamp, you're watching these stupid. First of all, never get me talking about any of these medical shows, Grey's Anatomy and stuff like that. I will not watch that garbage if my life depended on it. Okay, you will live another 100 years if you could watch the great. I said, kill me now. Okay, I mean, it's just, I don't like it because they're filled with all kinds of mistakes and stuff like that, and it's too sappy for me. But what happens? They'll be in the surgery. Stat. They slap this thing in their hand. Basically what they're talking about is they're talking about a hemostat. Hemostat is a small little instrument, and they clamp the vessel. And when they clamp the vessel, it's like taking a plug and sort of like, grabbing something so it doesn't bleed. Okay, so basically hemostats provide hemostasis, or they stop or control bleeding. Okay, hemo means blood, stasis means stopping or controlling, and urea means a characteristic of urine. Okay, hematuria. Hemato means what? Blood. So hematuria means bloody urine. Pyuria would be pus in the urine. Dysuria would be what? Painful urination. See how the beauty of medical terminology? I've changed that word around, Anuria. Anuria would be what? No urine. Polyuria would be what? Much urine, lots of urine. So basically I could take that word and turn it around. So basically urea means a characteristic of urine. Okay? So that's a common thing. So what we've talked about in this video is we've given you another long list of a number of suffixes. And am I going to expect you to know these? And the answer to that is just simply yes. I'm going to want you to know these suffixes because these are some of the more common ones. Guess what? We're not done. I'm going to be throwing suffixes in for the rest of the semester. Many of the times the suffixes they'll have in each individual section you've heard before. But I think this is a good place to start. Okay, we'll be talking about how that first homework will work a little bit later when we get closer to the time of the first quiz. But basically, I think learning these suffixes is really critical because it's going to help to you to be able to identify a lot of words very specifically. So I think I'd spend some time learning these suffixes. They're quite important. They're quite critical. And again, if I have a word root, the word root needs to be finished off with a suffix. They're always paired together. Okay, so that's what we want to talk about today. I have a nice long list of different suffixes, and so hopefully you'll sit there, you'll take some time, you'll memorize each one of these suffixes, and to be truthful with you, you'll be happy you did, because what's going to happen is going to help you significantly through the rest of the course. Okay, learn them now. Don't wait till later. You can pay me now, or you'll pay me later with a C or a D or whatever the case may be, but pay me now and learn them and you'll be doing really well. Okay, so in the meantime, stay safe, be healthy, and we'll see you at our next video.